My background is I'm a bit of a spiritual nomad, I would say, sort of traveling the world, experiencing how different people um, feel divine presence. And I also have a mixed background, my Chinese ancestors, my Indian ancestors, my Irish pagan ancestors, raised Catholic, sort of mixing all of these things together and trying to make sense of what thread runs through all of them.
Hello, I am your host Osheen, and this podcast is brought to you by Maps Canada. This podcast is for educational and informational purposes only and does not constitute medical, legal, or professional advice. Before we begin, I would also like to acknowledge that I am recording this podcast from the traditional ancestral stolen and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh people, which is now called Vancouver. So we have with us today Reverend Jeffrey Vidt, who's a spiritual care practitioner at a pediatric hospital in Ontario, a Fuller Seminary grad, and Johns Hopkins Religious Leaders Study participant. He advocates for integrating spiritual care into psychedelic therapy. He's also a board member of the Canadian Association for Spiritual Care. Sinéad Sullivan-Paul is also with us today. She holds a master's in psycho-spiritual care from University of Toronto. Her work focuses on Indigenous rights and supporting marginalized communities through spiritually grounded care. And last but not the least, we have Dr. Marc Blainey with us. He's a cultural anthropologist, psychotherapist, and a professor. He researches ayahuasca use and helps lead clinical trials on psilocybin-assisted therapy in Toronto. So welcome. How are you guys doing?
Very good, thank you.
Glad to be here.
Thank you for being here. Let's just get started. And the first question is actually for Jeff. So I wanted to ask you that you've worked in pediatric spiritual care and participated in the Johns Hopkins Religious Leader Study. How did that experience influence your understanding of the sacred altered states that we get through psychedelics use or non-psychedelic uses as well?
Sure, thank you. And I want to start off by just saying thank you for the opportunity to share my story and to come on with my lovely colleagues here and share things that are very close to our hearts around this emerging therapy that we see happening. And we want to really advocate for the importance of competent and professional
Mm-hmm.
spiritual care, especially within the healthcare context for this sort of thing. I've been a spiritual care practitioner my entire professional career. So I did my residency and my training at the Cleveland Clinic in Cleveland, Ohio, before moving up to Canada and working at several healthcare institutions in Toronto. So I was actually at St. Mike's in North York General before moving out to Ottawa, where I'm based now. And, throughout my history, I have been interested in mysticism and encounters with the divine. I grew up in a very conservative Christian household that sort of stood in tension this idea that people can have encounters with God, but that they didn't happen anymore. And the sense of like the only way that you can really encounter God is through scripture and deep reflection. And even then, it wouldn't be sort of auditory or have any kind of hallucinogenic or mystical qualities to it. So I grew up with a sense of supposing to appreciate encounters with God and see them as valuable and powerful for a person's spiritual development, but then also holding this sense of like it didn't happen anymore. And if it did, it needs to be distrusted, especially those that were done through the use of drugs or substances that were deemed illegal at the time. So it wasn't until I went to seminary and took a class on what was called the Christian spiritual journey, where I learned about Christian mystics that had experiences, very powerful spiritual experiences in the desert and in other locations, and how it grew to inform their theology and how they practiced their own spiritual life. And it was in that class that someone asked the question, has anyone ever had a mystical experience before? And one woman was vulnerable, raised her hand, and said that she had received her call to ministry in a mystical experience, and it was done while under the influence of LSD. Now, this was the first experience that I had seen of someone admitting to using drugs, and not only that, but having a very powerful and, according to her, very positive effect on her
Mhm.
professional life, on her sense of who she was. And so that got me very curious. And it wasn't until I came to Canada and heard through a Radiolab podcast actually about the Good Friday experiment that happened in Marsh Chapel, where other Masters of Divinity students, people training to be pastors, were uh, took substances to try to elicit a mystical experience. And it was in that podcast that they mentioned the religious leader study. So
Mm.
I had applied, inquired with John Hopkins, got in. One of the requirements was that participants needed to have never done anything like a psychedelic ever before, and that included my own experience. But they were extremely formative. I had two experiences on psilocybin in 2018, and uh, they were transformative in a lot of ways, not just from a mental health standpoint, but from a spiritual standpoint as well. I
Mhm.
grew to really appreciate the training and the context and the openness that I had nurtured and grown throughout my career. And, I tell people that I went into the study hoping to encounter God, and I did. However, it wasn't the most profound experience. The most profound experience I had was encountering my son, who was not yet born at that time. While I was preparing for the study and doing my preparation sessions, my wife and I found out we were pregnant with our first son, and uh, yeah, I went through all the things that new dads go through. I wanted to read all the books. I wanted to do all the things in order to prepare to be a good father for this new addition to our family. And beneath that, I was unconsciously, there was a lot of anxiety around this idea of becoming a father. And so I remember very vividly in my very first session, I had encountered what was a very large baby in front of me that I saw and could touch. And it appeared to be in utero, so it had translucent skin. It was very soft lighting, these types of things.
Wow.
And I remember sort of floating towards that baby and saying, I want to be ready for you. I want to be a good father for you. I implicitly understood this child to be my unborn son. And it was at
Mhm.
that moment where the baby reached out its arm and cradled me.
Oh my
And
gosh.
at that moment, I was struck by an idea, and I can only explain this as an idea that came from outside of myself because my theology, my spirituality at the time did not have room for this idea. But
Mm.
the idea was that this baby had selected me to be his father. In the Christian tradition, we have a lot of emphasis on the afterlife and what happens after you die, but we don't have a whole lot of conversation around what happens before you were born. And so that's why this idea seemed very foreign to me at the time. Uh, but it was also very powerful. This sense that out of all the people in the world, this baby chose me to be his father. I felt the anxiety that I was unconscious of at the moment just melt away. And
Mm.
that's been a very powerful idea. He is now 6. Um, his his life has not been without challenges. He was diagnosed with severe autism around 3 years old, and that's been challenging. But I'm still finding it very meaningful, those experiences, both that I had with God, but I also had with my son. And it helped me to appreciate the potential power that is in the experiences that these substances can elicit. It's not just meant
Mhm.
to help cure a diagnosis or help, uh, you know, a person may be struggling with addictions or end of life or treatment resistant depression or any of that. That's all well and good. But I think what's also important to understand is that you aren't just curing people's diagnoses, you're transforming their lives in big ways. And that is work, that is impact that's going to follow people for a very long time.
Yes.
And so I think institutions and healthcare centers and researchers and physicians all have a responsibility to understand that this is much bigger work than just
Mm-hmm.
what a diagnosis may require. We need communities, we need integration spaces, we need religious institutions and professionals to be ready to hold conversations with
Mm-hmm.
people who are encountering God, encountering things that are that they experience to be spiritual, and who have a spiritual knowledge and capacity and competencies to be able to speak to people in ways that are non-judgmental, that are taking their experiences to heart and are helping them find meaning in the midst of whatever it is that they're experiencing.
Mm-hmm. Thank you
I'll
so
stop
much.
there. Yeah.
No, that was a very beautiful story of your journey, of what you saw your son, sort of preborn son. And was that your intention, or was that the wisdom of the medicine that was sort of guiding you
Yeah,
through that vision? Or like, did
I
you
had
have a set intention before you sat for that journey, or was it just
no. I think part of the preparation work was very much training us to be open to
hmm,
whatever we were to encounter. I think my
right?
hope going into the sessions was to meet God and to
Oh,
experience God. Um, uh, Encountering my son was a bonus. You're right. I don't think there was any intention in that space. And I think that's important to
mhm.
recognize too, that when we encounter these substances, we don't encounter them
Yes.
as a blank slate. We come to it with our experiences, our knowledge, our unconsciousness that can be very powerful in them and take a lot of time to figure out and to
Hmm.
muddle through. You know, I don't want to say that everybody's experience is going to be a positive one. And so how do we
Oh,
help
yeah.
them make sense out of these experiences that can be very challenging and very scary
Hmm.
and transformative and in difficult ways. So how can we have people around that can support people in the midst of that? And I think we needn't shy away from the spiritual or from the religious or from the things that we maybe don't fully understand in the context. I think people want to talk about these
Hmm.
experiences with people that they trust, with people that they feel can hear them, with people with an expertise and even more so than just a medical context, but how can we help them investigate what these experiences can mean for their lives?
Yeah, for sure. I can think of so many people in my head right now where I'm like, you need to speak with a psychedelic spiritual care person.
Send them our
um,
way. We'd love to talk to them.
yeah. Well, thank you so much, Jeff. I want to ask you a question, Sinead. Your work bridges psycho-spiritual care and Indigenous rights. How can psychedelic therapy respect and honor Indigenous knowledge without appropriation? Because I live in Vancouver and I see way too much cultural appropriation when it comes to Indigenous rights or South Asian culture or Indigenous culture. So, yeah, how um, how does psychedelic therapy respect that?
It's great. It's it's such a great question. Thank you for that, Osheen, and for this opportunity to gather, and for Jeff, your incredible stories. I always such a privilege. So yeah, it's a really large question. It's a really important question in the context of psychedelics
Mm,
today that are becoming more popular. There is more of a trend, I would say, to take place, take part at a ceremony, either here or, in South America and other places. And it's quite costly. And there are some, there's appropriation that's taking place. I'd say my work with Indigenous voices, marginalized voices, is about uplifting the
mm.
position of those that we don't
Yes.
normally turn to for knowledge or wisdom. And that includes the plants themselves. And so, in the context of communing with the relative, the plant relative, the spirit itself of the plant. It's a living being. And so being able to be in right relationship with the land or with the plant
Mm,
means having a dialogue really with that involves consent. So if we're harvesting a plant, do we have permission to harvest this much? Do we have the
mm,
consent of this living being to engage with these intentions? Is it to make money? Is it to heal people? Is it to an individual end? Is it to the collective benefit? These are really important questions in terms of being aware of how we're approaching ceremony. If it's safe and effective, it has to involve these intentional
yeah,
questions. Am I ready for this ceremony? Is it an appropriate plant for my lineage? Are my ancestors calling me to engage with this particular medicine? And I think with creating that safe space for people to be able to experience whatever comes up and accept whatever's coming up, it requires consent, ongoing consent. And so being able to check in at every stage, at every level of whether we proceed, whether this is an absolute yes on behalf of the plant, on behalf of the land that we're having the ceremony on behalf of those guiding it and those, we're having ceremony with, it's a constant sort of presence and checking in with, um, do we take another dose? Do we stop here? Are we, is this the
yes,
perfect sort of, not
yeah.
perfect, but is this the appropriate set
Mhm.
and setting for
Yeah,
what
thank you so
aligns with
much.
my values
That's
as a
beautiful.
person?
And it I really resonate with that because I was born into a Christian family, but then I sort of grew up atheist, and then I found spirituality through gardening and plants and trees and animals. And like whenever somebody says, "What is spirituality to you?" I'm always just confused, and I'm like, "Will you understand if I say plants and trees?"
Mhm.
Um, and thankfully and gratefully, very grateful for this experience at UBC. I took a bunch of Indigenous courses and really helped me understand and see plants and animals as my relatives. And I was like, this is awesome. So yeah, that was beautiful. Thank you so much. Um, Coming to Dr. Mark, I wanted to ask you, how do you integrate spiritual exploration with clinical ethics in the psilocybin trials that you're facilitating?
Well, thank you, Osheen. I mean, first of all, it's not easy. I mean, science and spirituality for all of our lifetimes and probably for the last
Yeah.
500 years or so have been strange bedfellows. And that's something very interesting that's happening in the psychedelic world is that it's almost demanding new conversations, new dialogues happen, and hopefully in a respectful way. I sometimes think of there's a great book by a Canadian philosopher called A Secular Age by Charles Taylor. And he talks about how in Western society, at least speaking of North Americans, we have this tension, which he calls cross pressures, between hardcore materialist atheism, which I mean, I'm glad that my surgeon takes a materialist point of view when giving me heart surgery. That can serve us very well. It's how we invented iPhones. It's how we're able to speak on our computers over the internet right now. And then sort of a religious, spiritual uh, approach to life, these can often be seen as having to be in conflict, and that a lot of people today feel this tension and feel forced into having to choose sides. And Charles Taylor talks about a lot of people today are looking for a third way. Is there a way where
Mm.
these two different ontologies or ways of making sense of the world, do they have to be in such conflict, or could they be complementary? And while I can't speak for every clinical trial out there, the one I've been a part of, I did it over the last year at UHN, University Health Network in Toronto, a clinical trial run by a psychiatrist named Joshua Rosenblatt, funded by the Canadian Institute of Health Research. And I'm really lucky to be having worked with Dr. Rosenblatt before I began my new job at Martin Luther University College, that he really was open to this dialogue between spiritual points of view and UHN has now leaned even further into it to hiring more chaplains for their clinical trials. And I think what we're starting to see is that while psychiatry brings a lot of tools and a lot of critical knowledge and skills about neurochemistry, about pharmacology, like when you're listening to Jeff, if Jeff was sharing from the phenomenology of his psychedelic experience with the Johns Hopkins trial, a lot of what he shared about alternate dimensions and meeting beings that are somehow able to be dialogued with or interacted with on sort of an alternate plane of reality. That isn't something that's often taught in medical school or in psychiatry. And so we often see the old paradigm being, well, psychiatry is at the top of the heap and it is in charge of everything. There's sort of a knee-jerk reaction to dismiss or marginalize or call all of that experience that Jeff or anybody in these trials had sort of epiphenomenal or not worthy of consideration. What I see with this new paradigm shift, that psychedelics is part of a wider paradigm shift across biomedicine. In our clinical trial, we, rather than rejecting or sort of dismissing those experiences, being open to working with the client, setting aside our own countertransference for, it doesn't matter whether the clinician agrees with what the patient is saying or what the meaning the patient or the participant's making out of it, but that the most important is to set aside our own countertransference to have a patient-centered or participant-centered approach. But that is where I think spiritual care has a lot of our own knowledge and expertise about being able to manage one's own ontological biases so that they don't get in the way of the participant or patient being able to make meaning out of their own experience in beneficial ways.
Thank you so much for that. And as a psychology student, I understand countertransference, but would you explain it to the audience? What is countertransference and what can happen?
Right. So this is clinicians. All clinicians are human beings too. We have our own emotions. We're not robots, and AI hasn't replaced us yet. And
Thankfully.
part of what AI won't be able to replicate is that intuitive emotional sense of, it's one thing to express compassion, it's another thing to actually feel it. And we can often feel that from another being when we experience that positive countertransference, or the patient themselves having the transference experience. What it is the clinician countertransference is when the clinician has an emotional or cognitive reaction to what is said to them in the therapeutic alliance. And while that can be, if it's done with awareness, that can become material to build rapport and to help support the client with maybe empathy. Oh, I understand what an experience of grief is like, or some sort of suffering. But if it's done, if the countertransference reaction is unconscious or the clinician's unaware of it, it can come out in ways that are can disrupt or be harmful to the patient or the participant. An example would be, let's say I'm not, I'm sort of an open-minded person, but let's say I'm an atheist clinician in one of these trials, and someone says that they had an experience of God or they saw an angel or a demon. If I'm aware of my own countertransference, my own ontological bias, I can mindfully set that aside and put the patient's point of view first and foremost.
Yeah.
But I might have a countertransference reaction. If I'm not aware of it, I might start to make it clear to the participant that I disagree with their point of view, or I might start to try to convince them that the way they're making meaning of their experience is somehow wrong because it's making me uncomfortable. That's when it becomes clinician-centered care, where it's not in the best interest of anybody.
Thank you so much for that. That was a great example. And as you said, it can be so harmful from like even without knowing, it can be so harmful for the participants. So thank you so much for that. I wanted to ask this question to all three of you, and this can be popcorn style, so whoever wants to answer can answer first. But as I define my spirituality, as I find it in trees and animals, how do you each define spiritual or spirituality in the context of a psychedelic experience, or even without a psychedelic experience? What is spirituality to you? Let's have like simple answers so I can understand
Yeah,
it.
Man, it's like asking a sage to just define life in 2 sentences. This is going to be
I'm
tough.
sorry.
Um,
But what is your spirituality?
yeah, I guess I'll jump in. I answer that in a couple of different ways. So,
Okay.
one, I'm ordained in the United Church, and so I have a certain religious identity. I find a lot of value and meaning in Buddhist practices like
Mm.
meditation, following the Eightfold Path, and listening to Buddhist wisdom and talks. I find another way to answer that question is, where do I experience awe? Where do I experience a sense of connection? And I do find that a lot in nature, in reading books of thoughts that get me thinking, in embodiment. Um,
Mm.
I was reflecting on a moment the other day where my son was just swinging in a swing and had a huge smile on his face, just feeling the wind in his face. And so that was a spiritual moment. Those moments that help you feel connected to who you
Mm.
are, to the people around you, and to something greater. I really love Sinead's comments around how important it is to go out and seek that wisdom of those who have gone before us, because there are communities and cultures who have been working with these substances for way longer than we have and have a
Mhm.
lot to teach us, and we would benefit to hear from them. um,
Mm.
and then to speak to Mark's point, even around the idea of countertransference, what struck me, and as he was talking, is one of the images that was really significant in my experiences was that of the snake. I had a couple encounters with a snake,
Oh.
and if I were only drawing from my conservative Christian tradition, that would likely not have been a positive experience, because the snake is not a very good image in that. But because I had different training, because I had different awareness, because I had openness and appreciation to the beauty found in other religions, and had been curious about the images and metaphors in those faiths that were important, I realized that actually, in some faiths, in some cultures, the snake is a really powerful image, a very
Yes.
positive one. And I can relate to this in that same way. And so it made what was potentially a challenging experience into a very positive one. And I think that's another point in favor for having spiritual care practitioners in the room
Mm.
during sessions, because people are going to be spouting and sharing imagery and metaphor and language that the professionals may not have all that access to or education in, and
Mm.
we do. Every person on this call is training to be a certified spiritual care practitioner, and that is a
Yes.
specific title in Canada that is a lot of education, a lot of competencies. In Ontario, we that can be supported, where many of us are registered psychotherapists as well.
Mhm.
So there's a lot of training and a lot of expertise that goes into it, but like Mark was saying, we don't want to shy away from the spiritual language, because there's a lot of potential meaning that comes from that too, and how people define it for themselves.
Thank you. Sinead?
Yeah, thanks. Thank you, Jeff. And Osheen, I lean toward the natural examples of spirituality because they're so relatable. My background is I'm a bit of a spiritual nomad, I would say, sort of traveling the world, experiencing how different people um, feel divine presence. And I also have a
Mhm.
mixed background, my Chinese ancestors, my Indian ancestors, my Irish pagan ancestors, raised Catholic, sort of mixing all of these things together and trying to make sense of what thread runs through all of them. And so for me, it's sort of, there are infinite ways to view the sun. It's for me,
Mhm.
spirituality is what gets you there in terms of connection to something greater, to each other, to your sense of self, a sort of belonging, um, and a sense of sort of, yeah, like love, I would say. And so it's
Mhm.
that which moves through the seed to make the flower, and it's constantly moving, this life force, this energetic connectivity. And I think that the more we can attune to those, the more we can be available to all of the different iterations and examples of that, which really enables spiritual care, in a sense that whatever way spirituality is manifesting, we're open to it, we're accepting of it, we can
Yeah.
be with it. And that manifold effect, that infinite iteration, just adds to the sort of magic of it all. So, yeah.
Thank you for that answer. Mark.
Thanks. Yeah, not an easy elevator pitch question, but I'll give it a shot. I think to jump off of both what Jeff and Sinead are saying, I mean, Jeff mentioned connection. It makes me think of the original Latin meaning of this word religion that gets thrown around. Comes from relegare, to relink or reconnect. If I think about us human beings are so different, but something I think that's similar is we all know if I'm feeling disconnected from myself, disconnected from other people, disconnected from the wider world, I'm probably feeling pretty bad as a human being. And so there are so many different avenues, psychedelics being one that I personally have found helpful, but meditation, yoga, walking in the forest, being with other people, spirituality is really in the eye or the perspective of the beholder. But this idea of connection, reconnection with self, reconnection with other people, reconnection with the wider world often leads to people feeling a bit better about themselves. We often, we have so much conflict and tension between different religious points of view, or even with people that have non-spiritual atheist points of view. I like that old Sufi teaching story about really in the end, none of us really know. We're all like a bunch of blind people trying to figure out what an elephant is, you know? And
Yeah.
I'd even say like there's one religion's trying to figure, well, it's like a big fan, like has the ear, or it's like a broom, like the tail. The atheist might have a very good perspective. They're underneath the elephant saying there's nothing here, but that space underneath the elephant's really important too. And I hope that psychedelics and this recent movement is going towards more of this perennialist mutual respect of, hey, whatever floats your boat, whatever makes you feel connected and more at peace with yourself, I'm all for that. Um, I think too often we get more concerned with being right rather than getting it right. And so I just sort of close. Like I started off. There's a line when I did my research with the Santo Daime ayahuasca religion, going to a bunch of their rituals. There's a famous book, probably the Bible on ayahuasca experiences by an Israeli psychologist named Benny Shannon. It's called The Antipodes of the Mind by Oxford University Press. And he says that when he began his journey of going to ayahuasca rituals, he was an atheist. And at the end of his research, he no longer was one. And that's quite a profound transformation. I don't know if I would
Yes.
go that far. I'm more of an enchanted agnostic, open-minded, but I do hope as this continues to grow in our society that we find ways to let each other make sense of it in our own way rather than having to worry about being right.
Yeah. I like that you call yourself an enchanted what was the
Agnostic. Agnostic is
agnostic.
that I don't know, but I find the question very interesting, the nature of the universe. And then a disenchanted agnostic would say, I don't know and I don't really care. So I'm more on
Mm.
the
And actually, Mark, I just want to ask you about the Santo Daime study. What can, and again, this is a broad question, so what can Western psychedelic therapy learn from the religious or ritualistic uses of psychedelics?
well, everything. My big hope, my big plug would be that I think whether it's the Santo Daime is one of many entheogenic traditions, the Bwiti religion of Gabon and Western Africa, the Native American Church with peyote in North America. Really, as Jeff mentioned earlier, there are a lot of traditions, non-Western traditions, that have been working with these medicines and treating them as revered sacraments for decades, if not centuries. They have a lot of wisdom to teach us. I mean, if you want to learn more about the Santo Daime, I published a book called Christ Returns from the Jungle. that goes into way more detail than I can now. Another place I'd point to is a recent book by an anthropologist named Michael Winkelmann with the publisher Brill that just published a book called The Handbook of Entheogenic Healing, and trying to go through all these different traditions and bring their knowledge more to our awareness. One example I've put forward, there's an old movie called The Gods Must Be Crazy. It's about a
Yeah.
African man, you might be familiar with it,
Yeah.
where a Coca-Cola bottle falls down into
Yes.
the desert, and he has no frame of reference, and he wonders, why is this Coke bottle here? The gods must have put it here. They must be crazy, and they want me to get rid of it. The tribe is trying to figure out what to do with this Coke bottle. Is it an artistic tool? Is it a grinding tool? And from the audience's perspective, boy, it looks like these naive people in Africa, they don't know what a Coke bottle is. They're using it for all these silly reasons. I sometimes think that that's a good metaphor for how non-Western traditions that have been using these medicines for a long time are viewing the way that my culture is using them now, just sort of
Mm.
arrogantly assuming that we know what to do with these medications. But I think many of the ways um, that we're sort of rushing headlong into thinking we know best how to use them might look kind of silly or naive from the standpoint. And that's why I think we would be smart and wise to go to speak and ask some questions to people who have much more experience than we do. And my hope is that more of that's going to happen. It's as easy as showing up and starting to maybe trying to find ways to attend some of these ceremonies and talk to people, or read all the great anthropological literature that's out there by many folks. But thanks.
Hey, we hope you're enjoying the podcast so far. Now, if you want to support and become part of the psychedelic movement, feel free to donate to MAPS Canada at the link in the description below. Thank you for helping our mission to support equitable access to legal and regulated psychedelic medicines for all Canadians.
Yeah. Thank you so much. I want to ask you, Jeff, can you tell the audience about the Canadian Association for Spiritual Care?
I'd be delighted. Thank you very much. So, yeah, the Canadian Association for Spiritual Care is a education and certification body that certifies all spiritual care practitioners in Canada. We're affiliated with some American associations, namely the Association for Professional Chaplains and for the Association for Clinical Psychospiritual Education. But what we do is we provide education in the form of psychospiritual education units at sites all across the country. So those include hospitals, they can include potentially prisons, they can also include contexts like community counseling or other psychotherapeutic sites where people can learn psychotherapeutic and spiritual care competencies, and then ultimately become certified as spiritual care practitioners. Most of our members are very active in healthcare settings, so they serve as practitioners in hospitals and long-term care centers. But we also have members who are serving in the military as military chaplains. They serve as spiritual care practitioners in prison contexts or in community counseling contexts. And I want to emphasize, we by no means proselytize or evangelize a particular faith. In fact, we are explicitly trained for people to engage with the spiritual resources that they already have. So while we're coming from our own religious backgrounds, we're trained to meet people where they are in a spiritual sense and help them connect to whatever it is that might be spiritually meaningful. You know, when you're in a hospital and you're encountering people who have experienced loss of a loved one or possibly something very traumatic, that is a very significantly challenging time where people might be experiencing a lot of existential questions and find that there's very little space to explore or to talk about that, especially in the hospital. And so when we talk about, often when I talk about my role in the hospital, I say there's a religious component. There's things that I do to help connect people to their particular faith, allow them to practice their religion while in hospital, or seek sacraments, or seek connection to their community. But there's also a very large spiritual component, and that is around helping people make sense and make meaning out of what they're experiencing with the resources that they have. And if they find that the spiritual resources that they've had up to that point aren't helpful, then I help engage them in exploring whatever path they'd like to try. And
Mm.
so uh, spiritual care is much more than just a clergy person going in and talking with somebody about what they should believe about God or whatever. Spiritual care is much more sitting with myself, understanding and
Mm.
having a lot of self-awareness about what my own biases are, growing in appreciation for the diversity and for the beauty that's out there in a spiritual landscape, and then helping people and noting people when they're
Mm.
encountering really tough times. That's a vulnerable place to be, and we want to be able to care for them in the best ways that we can
Mhm.
with spiritual language and spiritual tools that are not always accessible. Um, so within the Canadian Association for Spiritual Care, we have a code of ethics. We have a set of competencies that students are expected to learn and to experience when they become certified spiritual care practitioners. We also have a lot of funding for research and for we have an annual conference every year. I'll highlight that anyone in the public can become a member of the Canadian Association for Spiritual Care. You can just sign up to be a member if you're interested. But we have a whole process for certification. And
Mm.
we welcome people, if they have questions, to visit us at our website. It's spiritualcare.ca. We'd happy to
Mhm.
engage in conversation. There's lots of us throughout the country that are always keen to talk about everything spiritual care. But we would, yeah, we'd love to engage people and see this conversation happen a little bit more, because when you're reading the headlines and you're seeing everything happening around psychedelics and psychedelic therapy, it's not often that you see spirituality rise to the surface, but we're seeing it more and more. I was actually just engaging with our executive director the other day and mentioned that since the study and since psychedelics has become more mainstream, this is one of the first times that in our organization's history that we have people coming to us asking if we
Oh.
offer spiritual care training, because they're recognizing that in their psychedelic work, people are having a lot of spiritual experiences and they don't know how to
Mhm.
engage with them or how to talk about it because they didn't expect it. And
Yeah.
so we've had several organizations and people approach us to say, do you have training? Do you have things that we can offer in terms of education to
Mhm.
help our practitioners learn how to more responsibly talk about spiritual dimensions to this care? So you're seeing it happen out there.
Wow, that's amazing. And yeah, even in my journeys, I had something where I was like, wait, but I was raised Christian. And then I had Shiva come in,
Mm,
and I was like, oh,
mm,
my mom was a Hindu, so my
mm,
mom's lineage is coming in, and but like I never saw her practicing Hinduism, so I was
mm.
just like confused. This is a really interesting conversation, and I wish we can continue talking. My next question is for Sinead. So, like you said that you come from like different cultures and lineages. So, how does spiritual care look similar or different compared to? And also, you worked in the research in Maasai in Kenya and the Chippewa First Nations in Georgina Islands. Like you've done so much work. So like, and also your own different ancestry. Like, how does spiritual care look similar or different?
Um, I think at the
Mm-hmm.
core of spiritual care, it is celebrating the differences between the way we encounter the divine, and being able to, yeah, it's been said before by both Jeff and Mark, to recognize our own biases
Hmm.
and to recognize, oh, that's maybe coming from my mother's lineage, as you're saying, Osheen. Oh, that's really interesting. How is that affecting my experience right now? And how is it imprinting my understanding of spirituality and how I relate to everything? And so I feel that the differences the specificity actually lend themselves to a universality, if that makes sense, that our own very private experiences in our own journey, really, it's up to us to experience and to acknowledge where this meaning is coming from, and to have a sort of relationship with it. Can be our dreams, it can be our sessions, to find which meaning feels the most relevant, appropriate, potent. What's the most medicinal sort of interpretation for me as an expert of my experience? And so the several different backgrounds that I come from is really lending itself to being led by the person having the experience, because they know best where that might be coming from. And really to facilitate a space of curiosity and openness to let whatever ancestor, whatever energy, or whatever meaning enter that space without reservation, so that it can be realized, or that it can be communed with, that it can be understood more than if we were resistant or a little bit unsure about what's entering the space. And so in that sense, I think it can connect us to our roots in ways that, being a descendant of indentured laborers, we lost our mother tongue, we lost our names, we lost our place of home, of belonging in our land. And these experiences through psychedelic, through plant medicines, have been a way of reconnecting to those roots, feeling that sense of kinship in ways that have been severed and harmed. And so being able to sort of, I think of the sort of like mycelial network system of reconnecting to the mother tree, these offshoots, these seedlings that are needing spiritual nourishment, and being able to receive that from a wise, rooted, deep source that we came from, that we're derived from. And that looks different for everybody. Yeah. So it really is, I'm an expert at none of these cultures, but we're all trying to find out a little bit more of what's been lost. And I think that the more we can invite that, the better able we are to hold all of those beautiful differences and celebrate them.
Thank you for that beautiful answer. Yeah. Marc, you are also a professor of spiritual care and psychotherapy at the Martin Luther University College in Waterloo. So, as a professor of spiritual care, what is that one lesson that you want your students to leave with?
Well, I mean, you mean in terms of psychedelics or in general? I'll take that as a psychedelic since it's coming from
Sure.
MAP.
Yeah.
So yeah, another way to think about, I mean, for a long time it was called chaplaincy, but that did come out of a very Judeo-Christian, very sort of Christocentric standpoint. So this wider, more encompassing category of spiritual care. Another way to think about it is spiritually integrated psychotherapy. And so I think of it is a type of psychotherapy that is aimed at trying to, we're steeped in clinical training, as Jeff was mentioning, our competencies, but we're looking for ways to invite people's spiritual or ontological or existential meaning making preferences into to use them, bring them in as a strength in their overall healing process, working towards well-being. I think of the words psychedelic or psychotherapy, both have that Greek term psyche, which we often think of as mind. Sometimes psychedelic is translated as mind manifesting, but psyche for the ancient Greeks also meant spirit. They didn't make this distinction. And so is it spirit manifesting? It makes a big difference between if someone, oftentimes people talk about hallucinogens. That's a loaded concept that presumes that, let's take your example, Osheen, you had an experience of Shiva coming into one of your experiences. If I have an atheist point of view, I might see that as, oh, that's an interesting vision that came up to my mind's eye. Maybe I read it from a Jungian archetypal standpoint if I want to work with it that way. But someone who's like my informants from the Santo Daime would take a more entheogenic view, that this is the revealing of a real divinity. There's actually Shiva really there, is coming to. Now, that's all fine and good for different people, different strokes, different folks. What I would say to my students or anybody I work with in the future is, our job as spiritual care practitioners is to support people to make meaning out of that experience, however fits them and their worldview. And by that I mean that we want to be really careful and sensitive to each person making sense of it how they want to, and that's why I think the integration process is so important. We
Mhm.
often focus so much on these fantastic experiences, which they can be very impactful. That's why it's so important to have someone with, and I hope we as we professionalize this clinical practice as a specialty, that people are the clinicians supporting people are very trained in managing their countertransference on big ontological questions like this, so that we can help people work with the medicine. You might, somebody, as Jeff has mentioned, and I wonder what Shiva meant to you afterwards. There's a big difference between saying, okay, that's a nice vision and let's move on and look at other stuff because it makes me uncomfortable as the clinician, versus, hey, I wonder if you can go around and go away and do some reading or some reflecting on that and what that means to you. Was that a positive experience? Was it a negative experience? So that how the person walks alongside, how the clinician walks alongside the patient or the participant makes a huge difference for the ultimate benefits that person might feel, or whether or not they feel sort of like their spirituality has been discounted. And so I'm hopeful that all clinicians that do this work have some sort of spiritual care training, or at least know to refer to a professional if they get into deep waters.
Thank you so much. Yeah, because even if somebody, like how Jeff was saying, you saw a snake and it can be a really like demonic, bad, satanic symbol from the Bible, but it can be like Shiva has a snake around his neck, right? And like that's a completely different image. And as you're saying, Mark, like it can be so important to differentiate between these things. But my question is like, don't you think like people who are strongly religious or strongly spiritual may feel betrayed by this sense of vision, like you trying to tell them like, hey, no, snake is a good thing, it's not a satanic symbol, but they can be like, no, but I'm betraying my values, like what I've learned. um
Yeah, that's
There's
why.
lots to be curious about there. Yeah.
Right. I'd want to be careful to say, yeah, we'd have to be very careful. That's part of our training, is never to tell people how to interpret their
mm,
experience. It would be more a wondering about, how did that experience make you feel? How do you feel about that? We want to be very careful
right,
to lead the person into some interpretation one way or the other.
Mhm.
right.
Mhm.
Okay, Jeff, do you want to say something about that?
100%. I think there has been some conversations and some readings. I'm blanking on the article right now, but where a common conception within some religious circles is that using psychedelics or using these symbols is actually opening a door that should not be opened. And so
Mm,
it can create a lot of stress in the sense of it, like there's the opportunity for demonic forces to come in and influence me.
mm-hmm,
Just as we don't have the right to say what's good, we don't have the right to say what's bad either. I think it's
mm,
what's important from the spiritual care side is, again, meeting people where they are, hearing
mm,
how they're experiencing and interpreting the experience, and helping them integrate it in a way that can be helpful to them. And that doesn't mean telling them, well, you're wrong about this metaphor, so this is what it could be, but allowing
mm,
them to explore and be curious and hear the story and how it connects to who they are in the depth. So if somebody were saying, well, this is a betrayal of my tradition, the first question I'd ask is, how do you experience that? Does it feel
mm,
good to betray your tradition? Does it feel bad to betray your tradition? How can you remain true even though
mm,
this experience maybe counteracts it? What's challenging about that? What's not challenging about that? And not to jump in and assume that that means it's a bad thing or a good
yeah.
thing. In either way, just walk alongside them.
Yeah, thank you. Thank you for chiming in. Sinead, I wanted to ask you, so what does justice-oriented approach to psychedelics and spirituality look like you? Like, I'm also a very social justice motivated person, try to do my best with these things, but it is so, I will let you answer.
Yeah. Uh, I feel that part of the spiritual care training has
Mm-hmm.
also been an acknowledgement of dominant cultures and dominant narratives within the medical industrial complex. And so I think being justice oriented means confronting those dominant narratives and finding the safe places to work through what might be an adverse side
Mm.
effect of a psychedelic experience and what might be part of the set and setting that someone is in that they might be encountering that isn't necessarily theirs, and being able to create an understanding or at least a space for those less dominant narratives or interpretations to exist. And so part of that is, as I mentioned before, uplifting marginalized voices. And so having marginalized folks, um, QPOC folks, Indigenous specifically, if we're doing something on, sacred land, to be present and to hold not just a token value, but an actual rooted reverence of reciprocity in the process
Mm-hmm.
of engaging with any sort of therapeutic modality, psychedelics or otherwise. There has to be a recognition of all of the agents involved in this process. And so as Marc mentioned, as Jeff mentioned, it really is client focused, bringing in the fact that their lineage has different interpretations, but also that they're raised maybe in this culture. And this culture is more just for some than it is for others. Recognizing that the interpretation or the struggles that this client may be having may be due to their position within a particular culture. And so being able to gather and create safe spaces for people who feel marginalized or want to explore spaces that maybe aren't dominated by a particular culture can be an incredibly safe healing experience as a reference point when those walls do come down in a psychedelic experience, because we're really doing a
Yeah.
sort of surgery on people's consciousness that
Yeah.
level of vulnerability, anything can get in, whether it's the bright white clinical atmosphere, whether it's the presence of the other people in ceremony with you, whoever's guiding you. That boundary setting is really up to the person guiding or the
Mm-hmm.
care provider, the person in that non-ordinary state of consciousness. All of
Yeah.
those walls are down. And so putting in protections, asking the right questions before we're engaging in ceremony, doing our research about, the history of these folks and what their protocol is spiritually, their spiritual
Mm.
hygiene, how they're going in to a really sacred space and beyond, I'm missing the word, but beyond countertransference, what are the narratives that a person is coming in with
Mm.
that they're really grappling with? And so that's where like a pre meeting, getting to know people before a session, as well as the integration after, to understand a little bit foundationally of where this person may be coming from, and providing the safest possible space for them in the context of where they're positioned in this culture. So it's really, I think, creating more resources for those who are under-resourced, if I was to put it in a sort of
Yes.
single sentence, and creating more equity if we can see little spaces where that can happen. It's
Mm-hmm.
especially important when they're vulnerable in a psychedelic or non-ordinary state of consciousness. So thank you for that question.
Thank you for that answer. And I also want to say that even though everybody, I'm sure everybody's trying to have that equitable uh, space for marginalized communities and to BOC, BIPOC people, I I feel like there's still such a huge lack of people of color practitioners and clinicians from marginalized communities. And do you think in spiritual care world is that changing, or does it look like similar to the Western care world?
I mean, we've seen change just in the term of chaplaincy to spiritual care, right? And so there's been
Hmm.
transformation. in terms of representation and working with folks who have maybe a similar background or are marginalized in a marginalized community, there is a sense of understanding and mutuality. Like I think when we're working with people, so I think there is an increased interest in working with folks of color or queer practitioners, for instance. But I do believe that we could resource these practitioners more. We could uplift them. We could create spaces for them to speak and their voices to be heard, their publications to be featured, and really divert some, more investment really in every possible way into these practices.
Yeah.
It takes time. I think it does take time, but there are changes occurring, and I'm hopeful.
Sure.
Mm.
Thank you. Yeah, I'm a hopeful too. Jeff and Mark, do you have anything to say about the last question I asked Sinead?
I think I just threw in there that one of the clear competencies within spiritual care providers is having a lens towards equity, indigeneity, and social justice. We have a set of recommendations that have come from an internal practice committee of a reconciliation council that we have been working towards. It's going to take a long time to completely decolonize our association, but we're working towards that end, and we know that the work itself is ongoing. And so, if we're going to be spiritual care providers in institutions and communities and organizations that have unconscious biases and have colonization practices and are still subject to a lot of westernization lenses, we got to practice what we do and what we say. And so it's part of the work. I have a clear sense of responsibility, having been one of the very few people that has legally taken a psychedelic substance as part of a research study. But I'm also very aware that that research study had a lot of white Christian, people that were participants, and that's something that we need to be aware of. That even in terms of access for a clinical trial, a lot of that is going to go to the more affluent, the more culturally privileged, and what can we do to push against that and give access to, like Sinead was saying, the more marginalized communities that have just as much right and likely has even more relationship and more connection to what can be beneficial in this work.
Yeah, thank you. Uh, I'd like to throw this in for Mark. What do you think the future of psychedelic assisted spiritual care looks like, other than making it a more diverse place for marginalized communities and safe space? Yeah, other than that.
Right. I mean, yeah, just to sort of link that with the last question. I mean, I am a white, straight, cisgendered male, so there is a disproportionate amount of people with my identity in this field, and I'm hopeful and quite optimistic that by the time I'm a really old guy, that will have changed quite a bit. I would, one of the ways we learn allyship is to how do we amplify marginalized voices. I can think of just off the top of my head, like I work MAPS Canada, so there's a great program that started now at the University of Ottawa, graduate program in psychedelic spirituality. It's run by Anne Vallely from the Religious Studies Department, an anthropologist, but also Monica Williams, who's been a
Yes.
real world leader of
Yes.
really trying to change the sort of overly white male dominance of this field. I see there's a book I'd like to assign when I teach a course in this that Monica Williams does the foreword in, called Black Psychedelic Revolution, by a scholar named Nicholas Powers. So we do see this changing quite a bit. How do I see the field changing more widely? Well, I think the more voices we consult, the more we're going to see an evolution of the actual format. We've talked a lot today. I know Sinead was really highlighting this, of how much mindset and setting, like back to the basics of the 1960s, set and setting is so crucial for safety and effectiveness and how an experience unfolds for someone. I can think of one example being that I just got out of this clinical trial where we started with paying 2 clinicians to sit with one person undergoing the experience. That makes sense from a very individualist standpoint of Euro-Western biomedicine. But as we start to bring in other voices, I think it's going to become clear that the best way to do this is in uh, a group atmosphere where there's interpersonal
Mm-hmm.
exchanges, where people get to have the experience alongside other people, that they get to not just talk to clinicians, but to peers as they go through the experience together, to mirror each other and to help support each other. That's the way we human beings, we're social beings. And so I really, not only would that be, I think, more effective and even safe for people to feel like they're not all alone in the experience, but at the same time, I think it's also makes it more cost effective in that you don't have to pay 2 clinicians a 2-to-1 ratio, maybe more of a 1-to-1 ratio.
Yeah. Yeah, thank you so much for that. That will make the trials faster and the results come better and faster as well. So thank you so much for that. Um, Thank you so much, all three of you, for this wonderful conversation. And lastly, I just want to ask, and I ask everybody, is there anything that any of you wanted to talk about that I did ask you about? And if there's anything, you can take the stage.
I'll just
Yes.
jump in and raise. I'm the nerd. Well, we're all nerds here, but I'm a nerd. It's got another the work of Reginald Bibby as a sociologist at the University of Lethbridge, and some of his recent work at the end of his career was focused on asking a question: how many people still believe in God? How spiritual is our
Mm,
population? And as late as 2020, he found that well over 50% of people in Canada still believe in a God, and it's really about 40% who don't have an interest in that, and that proportion might change. But what I'd like is for psychedelic science to be a lot more aware of that while the clinicians that are designing these studies, the proportions might be quite high for them having atheist leanings. Um, the people that we're going to be serving in clinical trials, and then if this goes out wider and to become mainstream medicine, are bringing their religious beliefs into these settings. And so my hope is that we continue to focus on a client-centered approach of being respectful of that. The scientists, not everybody that's going to be working in these trials believes what the scientists believe.
yeah, yeah, absolutely.
And
Thank you so much. Yes, Chef.
I would add to that too that the responsibility goes also towards our religious communities and organizations,
Mm,
that these churches, these mosques, these synagogues, these places that have uh, religious participants and communities, I can guarantee you there are members of your communities that have had psychedelic experiences and they want to talk to someone like a religious leader about it, but are likely afraid to do so from fear of judgment or not sure how a reaction or response would be like. And so, even as this becomes more and more mainstream in the healthcare field and in the medical context, I think our communities, and in particular our religious communities, need to be safe, non-judgmental places where folks can come and process and integrate and talk about some of these experiences because they want to, and they want to be able to try to make sense of what they've experienced in a religious and spiritual way. So making sure that the leaders in these areas are properly educated and have live their values of compassion and care for their communities as much as they can.
yeah, great point. I agree 100%. Thank you so much for that. Sinead, any last thoughts?
Yeah. Yeah. I mean, as someone who's had sort of both
Mm-hmm.
ends of the spectrum and many of the aspects in between in terms of enjoyable, pleasurable experiences and very uncomfortable, very disorienting experiences, I would really encourage those who may not want to talk about it or may feel isolated from their communities or may feel that this has brought about a certain level of misunderstanding or that they won't be understood, to remember that there are people who have been in your shoes and have had these experiences, as Jeff was saying, in your religious communities, but to reach out and to try to find those people, because it is very difficult. We're not built to do this alone. We are community people. We are a herd, so to speak. Tapping into one another's experiences and feeling like we're not alone is essential to integrating and to sort of mining the gold of these experiences, pleasurable or otherwise. So please feel free to reach out to any of us through, the website. The Canadian Association for Spiritual Care has a lot of different practitioners. You're not alone. You're not crazy. These things happen. These things, it's wild. It's wild to be alive at all. Let someone you trust help you make sense and come through, because it's really worth it on the other side.
Thank you so much. That you ended that beautifully. Thank you. And thank you to everybody again for coming to the Maps Canada podcast. I'm really grateful.
Thank you very much.
Thanks, Osheen.
Have a wonderful rest of your day. Take care. Bye bye.
Take care.